For those of you who don't know about Good Sam, we've been around. Our 20-year anniversary will be next year. So we are one of the largest charitable care providers in Gwinnett. And we also offer dental services as well. And the only caveat to be treated here is that you are uninsured. So we have really great partnerships in the community. And we hope by doing sessions such as these, we can just introduce you to just a fraction of what we offer and certainly give you the opportunity to talk to us more if you are interested in learning more about Good Sam at the end of these. So this is very informal. I mean, it's meant to be informative. It's not meant to be presentation style. We don't have PowerPoints or anything like that. It's really a conversation. As Evelyn mentioned, feel free to put any question that you have in the chat so that, at the end when we do Q&A, we can address those. And we certainly want to honor your time and be done within the hour. So without further ado, I'm going to just talk to you a little bit about vaccines and how we are one of the providers that are referred by the school system and from the health department for those that may be in need of vaccinations and child checks. We believe that every child who goes to school needs to have access to this type of care. And sometimes it's hard, especially if you don't have insurance or if you're newly arrived or if there's a language barrier of some sort. We have all sorts of experiences in handling patients that fit this criteria. So I do want to take a moment to introduce Erin, Koch, who is, I'll let her introduce herself. And if you guys can make sure you're on mute. There we go. Perfect. I'm going to introduce Erin. I'll actually let her introduce herself here in just a second. But Erin is our vaccination guru, and this would not be a vaccination lunch and learn without Erin. So I'm so happy that she was able to join us. And she's going to be able to just really give us a great overview of what the process is for vaccinations, because I'm like, guess what? I don't know it as well as her. So let's make sure she's on. And how to just make sure that our kids are prepared for the school year. So without further ado, I'm going to turn it over to Erin, and I'm going to ask Erin to introduce herself and give a little bit of background about how long she's been at Good Sam. And Erin, maybe you can even give us your why of why you're here, because you've been with us for a minute.
I've been here for a minute. Thank you, Shameka, for inviting me to talk today just a little bit about the back to school process. My name's Erin Koch. I have been a nurse for 20 plus years. I have been at Good Sam for the last 7 of those. And I didn't really have much experience with the younger set or vaccinations until I came here. And I got a thorough introduction and have been working on processes and vaccinations for the past probably 5 of those. I've been a vaccine coordinator probably for the last 5 years of those. So the why of the Good Sam is, I was introduced to Good Sam by a friend's daughter, and she volunteered here years ago. I really kind of clued into the mission, and I really like the community aspect of it. Basically, putting your arms around the community and looking to the community to provide direction and not necessarily just pressing on with, healthcare objectives, but asking community members, finding out what the needs are so that we could meet their needs and not directing the needs. So our back to school offerings start probably mid-July when we start stocking our refrigerator with vaccines. We anticipate the needs for over the next couple of months. People start trickling in. And those are usually the people that have been in the community for a while. We primarily serve Gwinnett County, but we do often see people from outside the community. And a lot of those children are just here for their well child checks. We provide wellness visits in preparation for back to school. We provide dental visits if they need a cleaning, if they haven't, and some haven't had access to dental care ever. So we are sometimes some of their first point of care for dental. We offer school screenings. A lot of the younger ones, even to access daycare, they will sometimes need a school screening to evaluate their vision, their hearing, their dental status, and also their health nutrition status. We, do health or their height and weight. We'll check their BMI and make referrals based upon that. We also, as Shameka's talked about, vaccinate the children for back to school. One aspect that's probably unique to Good Sam is that we can offer them vaccinations, age-appropriate vaccinations without having to see a provider. We want them to see a provider for their wellness visits, but a lot of children are just seeking us for their vaccinations for back to school. So we work on protocols similar to like the health department, I'm sure, where you don't need to be seen by a provider first, but they will bring in their immunization records if they have them. And they'll bring in a birth certificate and ID for the parent ID. We'll then assess where their previous vaccination status. We'll enter it into the GRITS, which is this state database. This will round out their age-appropriate vaccinations, and we can assess from there what they need moving forward, not necessarily for school, but for age appropriateness, and to prepare them for back to school vaccinations. We'll give them their 3231 forms to present to school. A lot of times we are the first point of contact for for new arrivals. We can assess their vaccination cards from all over the world. We've seen all sorts, mostly from Central South America, but we have seen, I had two recently from Pakistan. They come from all over. Some of them are a little more challenging than others, but we do have access to CDC and WHO websites that can assist us in interpretation and appropriateness. So what we'll do is we'll vaccinate them per age appropriateness, which they can present to the school for this. And again, a lot of our students have not had any vaccinations. Some of them have had large gaps in their vaccination status. So we can help fill in those gaps. And sometimes we do need to start over. We can do that for them. Being a first point of contact, we want to provide education on basic healthcare needs and how our healthcare system works, because a lot of our patients are not familiar with it. We do, in this case, like to refer them to our dental clinic for a full evaluation there, especially if they've not had any access to dental cleanings before. We can refer them to for a well child check if they've not had any preventive health care before either. We at a wellness visit, we use the Bright Futures. That's the APP. Their format for well child checks. From there, we can make referrals out to any specialists any needs that are noticed. This gives the child a holistic approach to and not just targeting their school based needs, but a holistic approach that will benefit them later on. We hope that they become a Good Sam patient in the future, but we want to present this as a safe place for them to seek care. We provide interpretation services. We have people who can help them actually fill out their paperwork because a lot of them come in and a lot of our new arrivals, especially they can't read or write. So we do offer that little embrace that they might not feel anywhere else. Um, this the hand holding and education piece and basically closing the loop is our mission, so that they can go out into the community. They go to school. They can, hopefully encourage their parents to become a Good Sam patient as well and seek physicals for us. We also offer adult vaccines. We operate on the VFC and the adult vaccine programs. So whatever the Department of Public Health offers, we can have access to those vaccines as well. Um, we want to make sure that their parents are vaccinated. We participate in the flu program and the COVID vaccine. So we will probably be seeing those vaccines being distributed to the community probably by the end of the month, maybe the beginning of September. Once we see those, we'll start advertising for that as well. Some unique challenges we may have had. It's really just meeting the clients where they are, whether they can read or write, assessing their previous healthcare status, and you know, just trying to get them into school. Obviously, for the back to school programs, I mean, daily, even today, we have children that are waiting for vaccines and school screening just to go to school. So, I mean, I've had those just this morning that haven't been able to start school yet until we provide basic services for them. So at this point, I would like to send it back to Shameka, or if anybody has any questions, um, I'm going to check the chat real quick to see if there's anything, but
Yeah,
So,
there is, Erin, there is one question that came through. What are the usual charges for well child checkup and for dental cleaning and evaluation and for vaccines? So,
so historically, we have charged $15 for vaccines. And that's per antigen, which is basically per injection. So if they need a combination vaccine, that will be lumped into one. We try to mitigate any barriers to receiving vaccines. So it's usually around $15 per vaccine, if that's helpful. I am not sure. Dental gets a little tricky with their and not them, but just meeting the they need to be evaluated
mhm.
prior to offering pricing, and I'm not sure how much their pricing is. I'm sorry.
Yeah, so dental is definitely going to start with an exam. So if you just need to be as part of your school admission form, our providers can just take a quick look and make sure that you don't have any major issues. But for dental, we are a full service dental facility. So those that starts with an exam, which is $99 up until Labor Day. So that's what the price across the board. And once you get into treatment planning for children, it is and I see Shannon's on here. Shannon's our practice manager. Yay, from our dental practice manager. So Shannon, if I say anything incorrect, please correct me. But children are they're going to need an exam just like everyone else, right? Especially like Erin mentioned, if they have never been to a dentist before. And also, we are not a pediatric dentistry, so I'll be transparent about that. So we definitely in our clinics, if the child is old enough to be able to fully, sit still during a dental appointment and needs, we feel like we can safely treat them, we will certainly do that. And then if not, then again, we have many, many partners who we can refer to if it's an extreme situation that we feel like we can't safely treat on site. But I did want Erin to touch base. I know we sometimes get a lot of calls about the process, right? And so especially with some of our new arrivals. So if you're brand new to Gwinnett and you are told that you need to go and get vaccinations, Erin, like how should they do that?
So we like to have the patient, parent come in person just because we want to handhold a little bit, but we also want to make sure that they have all the proper documentation because we're entering the documentation into the state database. So we'd like them to arrive with an ID, a photo ID for the parent. We'd like to have some sort of birth certificate for the child and any previous immunization records. I've seen all sorts of immunization records. It doesn't have to be in good shape. I've seen lots of stains on the immunization record. I can read through a lot, but some people have literally lost theirs. And some people just don't have never had vaccination records. But the process is to bring those in. And they will have a front office staff person assist them. They will fill out a screening and consent form at that time. And that lets us assess the appropriateness and if they're able to receive vaccines or not. If something falls out of that consent form or the screening form, then we can make referrals to one of our providers if they need to if they need clearance first. But for the most part, they need to fill out that paperwork or have someone help at the front office, fill out that paperwork, and at that time they'll make an appointment. Um, Most of the time it could take up to a week to receive an appointment just from especially back to school time. We have a lot of immunization records that we're going through, so they may not receive same day appointments. Now, if they've been vaccinated in the state of Georgia before, they may be able to walk in, but it's just a case by case, day by day, how busy we are situation.
Thank you, Erin, for clarifying
Mhm.
that. And I
Mhm.
know we had another question in the chat about dental. And I know Shannon responded. So yes, we do offer dental services. We have a full scale dental clinic. So if you are an adult that needs dental care and are uninsured, we are able to treat you as well. So do we have any other questions? If not, then I'll kind of ask Erin to kind of give us an idea of what um, a testimonial, so to speak, of of some of the more difficult cases, or just not difficult, but just some of the more challenging
Mhm.
ones that we've had to kind of decipher our way through to give you guys an example of kind of our process of handling that.
Right. So our school screening, if someone's receiving a school screening and vaccines, just to let them know, it could take up to an hour. We allot an hour for vaccines and school screening just because of the number of vaccines that they may be receiving. Some teenagers, because of the age and some of the vaccines that may be needing at that age, they could receive up to eight. Um, it in one visit, and that's quite normal. There's no reason they can't receive that many. But that was just a little aside to let people know if they're doing both. Sometimes a school screening can take a little bit longer. We like to see our patients in and out in 30 minutes, but that's not always feasible. Some of the children that come in, especially some that have never been to a medical or dental office before. Um, I mean, they're overjoyed to be able to seek care. I mean, part of our mission is, I think I've said it before, but is to meet the patients where they are and fully embrace them. A lot of our patients, they've just never had the opportunity. So this is new to them. So we want to make it special, educational, introduce them to the healthcare system. We don't, I think for that reason, we don't see a lot of vaccine hesitancy, just because some of our patients have seen a lot of the vaccine preventable diseases, and they're just clamoring for access to care, vaccines, medical care, dental care. Um, and I think part of it is just letting them know that they can participate in this as well. Um, just having the first point of contact, sometimes they're just afraid. They don't know how to reach us. Some of them literally walk in the door saying, how do I start? Where do I begin? And I think that's where we want to be. We want to be open and welcome. We have, I don't think I've mentioned that we have interpreters. We can translate Spanish language paperwork. We do have in-house Spanish translators or interpreters, and sometimes that just makes them feel more welcome if they're speaking to someone in the same language. But we want to be their first point of contact, because we can be that welcome, that those that embrace that they may not receive elsewhere.
And Erin, I know we occasionally, if we do see a child for a well-checked visit, and through vaccinations and a well-checked visit, we have often, not often, but in some occasions identified further health needs that the child has had. So can you talk a little bit about how we would handle it if during a well child visit we discovered that the child needed additional care?
Right. So, because a lot of these children have never had any preventative health whatsoever, and this is their first well child check, and we may identify certain needs, certain gaps in care. We have a lot of community partners that we can refer to. Some of them, well, most of them are, at least a reduced or some free services. Um, but some of these are specialty pediatric care that we don't have the opportunity to offer. So we can give them a direct referral to that. We can access them if we don't know of someone. We have certainly investigated unique situations. We partner with CHOA. We can access them as well. We refer directly to them. Um, and just offering the extension that they may not know that they have access to. We've seen people come in with pediatric situations where, a pediatric cancer, or they need to further their care, and they just need us to be that link to care where they've received care in their home country, but we're just that important link to access care here in the Gwinnett community.
Yeah, and I know on some occasions we've had to do that, where we've had to refer the kids who come into specialty services. And I will say, for those of you who are from the school system, we have received referrals. We've had school counselors call us. We've had teachers call us on behalf of a parent. So if you are in the school system or know someone that works in the school system and they have someone in their classroom or someone that they know of that may need care, and they may not have, English may not be the first language spoken in the home. You can provide us, as long as the patient is okay with it, you can provide us with the patient's name and phone number, and we will reach out. As Erin said, we're very blessed. All of our staff here, all of our support staff are bilingual. So we have had to do that before, where it's not you don't call us, we call you to kind of get the situation going. So if you have someone that you would like to refer to us, please know that we don't mind reaching out to patients and getting that kind of the situation started, especially if they want a little bit more insight as to how the process goes.
Mhm, mhm. I see a question about the list of specialty providers. Our list is pretty exhaustive. We we do have uh, I mean it's just a number of referrals. We work a lot for our adults. We refer a lot to the Northside Hospital System, Marcus Institute. Um, we we have referred to the Marcus Institute before. It's my understanding that there's quite a wait list or time lag. Is that what you're seeing? Um, is that where the question is? We don't have any backdoor entrance, if that's what you're asking. I wish we did, but when we refer there as well, um, I know their list or their wait list is pretty lengthy,
Mhm,
and we are we wait in line as well,
mhm.
if that's helpful.
Yep, and that's certainly the case with some of our referral partners, but in a lot of the situations, I will say that it is better for someone, especially if they're newly arrived, to start with us because we sometimes do have contacts, direct contacts, especially within the Northside system, that we can call and with CHOA that we can, definitely reach out on behalf of the family to try to help expedite things or to provide some insight as to who the next point of contact should be so that you're not waiting and waiting and waiting. And I would say definitely the partnerships that we have with the medical hospitals here, whether it's Northside or Piedmont, are very, very good. They're very supportive of our mission. They understand that our patients are uninsured, so there's an expectation that there will be financial aid requests. We do have a care coordinator as well. So that care coordinator or patient navigator who will work with complex patients, whether that's an adult or a child, if we feel like there's some significant follow-up needed and help. We have just recently, as Erin mentioned, we had a pediatric cancer patient who we are working with her providers from Guatemala to get the necessary paperwork to send to her doctors here. And we are doing that on behalf of the parent because mom and dad, need help navigating through that. And she came here, I believe it was just for a well child visit.
It was.
Um, yeah, we do definitely try to kind of act as that go-between and make sure that that process is working.
Mhm.
And it looks like we have two more questions. If we can speak to the counseling services for adults and children. So we do not offer counseling services for adults or kids. I wish we did. Um, we do mostly refer to Viewpoint Health for those in need. And I don't know if that's certainly for adults. We are anxiously awaiting for Northside. I know they are opening up a mental health facility here in Gwinnett. They should be building that or being close to building that very, very soon. We've expressed to Northside the need for additional mental health services, especially for kids, because what we tend to see a lot of is kids come in for regular well check visits, and there are significant mental health issues that the parents will talk to the provider about in the room, right? No mention of it on the paperwork, but in the room, we discovered that there are some significant mental health issues that need to be addressed. So we are always interested in partnering with organizations. So you're on this call and there are other mental health organizations that you know of besides Viewpoint, Northside. I know there are some others out there, but I know we also have to keep in mind the cost, because most of our patients are low income. So we are always looking for, places that are willing to work with our population and understand that cost is definitely a factor when it comes to mental health services. And again, some places will take uninsured, but the rate is just way too high for it to be a viable option for our patients. So if Northside does indeed open up this facility that they are planning on doing, there will be a financial aid process for those services, which would allow kids, young adults to receive that care the same way they receive financial aid for any Northside service, which is a real game changer for a lot of our patients, because a lot of our patients, due to income, can be treated for free at Northside for little to no cost. So if this does indeed launch, we're happy to partner and refer with them because it gives us one more outlet. And of course, Viewpoint operates on a sliding scale as well. Another question: can a person who is a Sewanee resident visit Good Sam in Atlanta or other Good Sam clinic at another city? So interestingly enough, we are not affiliated with the other Good Sams. That's a very good question. A lot of times people think if they go to Good Sam Atlanta or Good Sam Cobb or Good Sam in Jasper, that they are seeing all one big company. We are all friends. We know each other. We're very familiar with the other locations, but we are not affiliated with them. So we don't have any sort of barriers to care from a like a county perspective. So you do not have to live in Gwinnett to come to Good Sam Gwinnett. You can live, we take people from DeKalb, Fulton. We got a lot of residents that come to us from Hall County, throughout the metro area. Some come as far as from North Georgia, especially for dental. So we have no residency requirements, but for sure, everyone is doing great work in the other Good Sam locations, but we are not the same company. So that's a good question. And then another question: do we offer medical for adults? Absolutely. We like to say from 1 to 95. We have providers who can treat. Now, we don't have a pediatric nurse practitioner. I want to be clear about that. But for, and Erin, correct me if I'm wrong, for general illness for kids, we certainly can see children. If it does become something that we need to refer to a pediatrician, we will certainly do that. But we will see from 1 all the way up to elderly patients.
Mm-hmm.
So good questions. Do we have any other questions from anyone? No? All right. Well, we're at 12:40, so it looks like we may get done a little bit early. So I'm certainly not gonna hold you guys longer than necessary, but I just wanted to thank Erin for her time and just talking to us, and Evelyn for setting this up and doing our wonderful, cool backgrounds here that we're gonna use for all of our lunch and learn services. So a couple of takeaways. Just know that Good Sam, we love to have people. Oh, we have a question from Kenya.
Yes, hi.
Hi.
I'm with Emory University School of Nursing.
Mhm.
So I'm glad to hear all of the services that you provide to our youth. I wanted to ask, do you need student nurses to conduct these screenings and assessments? Because our students need to have clinical experience, which we would consider this as an outpatient clinical experience for them to be able to meet graduation requirements.
Now, Erin, you can help me answer this question. So I believe those students have to train with a RN. So we only have one RN on site.
That's me.
And we do have the capability, Erin, to have students are assigned a clinical instructor. Now, typically that instructor may just come visit them for progress, but we do have instances where the RN can stay with them throughout the entire time that they would be on site.
Okay. Number one, I am not full-time.
Okay.
Number two, I wear a lot of different hats. So I'm not always on the floor. I primarily do school screenings and vaccinations 3 days a week when I'm here. But I also do a lot of operational an operational task. I don't know that I have the capability to, to be honest, to mentor one-on-one or have enough to keep them busy.
Okay.
Honestly, that would be something that maybe you and Shameka could speak about later on.
Okay.
But I don't know that I have a lot of nursing duties to keep them busy. Because, like I said, I'm not on the floor full time. I mean, I'm not even on the days that I'm here. I'm not on the floor full time.
Yeah, Kenya, that's a really good point, Erin. Like, so we
Mhm.
have operated historically on an MA model, and that we just do that to keep costs down. I mean,
Mhm.
we only have the one, Erin, our one kind of everything project manager, guru, staff nurse. But being a nonprofit, we one of the ways that we keep our costs down is by operating with MAs, and the MAs are actually, some of them can do vaccinations as well. We have everybody kind of operate to the top of their scope and the top of their training so that we are able to do this at the rate and the cost that we are, and that, in terms of our patients and being able to provide them accessible service. So
Okay.
that's the only reason. We love nurses. We think y'all are awesome. We would love to have more, but just due to our structure as a nonprofit, we go the MA route.
Okay. Well, yeah, definitely if you get to the point where you can utilize our student nurses because they are equipped to conduct assessments
Yep.
because we work with Atlanta Public Schools and we work with DeKalb County Schools and Cobb County Schools and some Head Start programs where our nurses will go out and help conduct the screenings, to take the weight
Mhm.
off of
Mhm.
people like you all that are doing
Yeah.
more multitasking all the time. So
Mhm.
definitely I like to, keep your information and just check back in with you possibly time to time.
Sure. Yeah, absolutely. Absolutely. Emory's my alma mater. I love Emory. And
Ah,
we do a lot of other types of training here at Good Sam. So
okay.
as I was kind of alluding to, I think what if you are interested in learning more about our clinic
Mm-hmm.
outside of just vaccinations, or you want to know more about our mission, we love to do tours of our facility. We love for folks to kind of come out and see what we're doing for the community. We have two locations, one here in Buford on Buford Highway in downtown Norcross, and we have a second location in off of Rockbridge and Jimmy Carter. So we have people from all walks kind of come and just see what we offer. So I just want to extend that invite to everyone who's on the call. Just contact us at goodsamgwinnett.org. And that email comes to myself, and I can get that email out to anyone within our organization, depending on what it is that you're looking for or what question you may have. Thank you, Evelyn, for just putting that in the chat. And also, if you have a patient, I mentioned that if you have someone who you think could utilize our services, if you go on the contact us at goodsamgwinnett.org, I would say that is the best way to start the process. If you call and you don't, maybe somebody didn't pick up the phone and you don't want to answer a voicemail, you can certainly leave us an email on that. And then we also have a web chat on our website. So that goes directly to our scheduling team. And of course, you can always call us. And Evelyn, I'm going to have you put this in the chat. It's 678-280 6630, and that's the number to our West Clinic. And Shannon, you're going to have to help me out with the number to East if you're still on. Hopefully she is. No, she's yeah, she's got me on. She's muted, so she may have stepped
I
away.
can.
Oh, there
Oh,
it
there
is.
she goes.
Perfect.
Okay, awesome.
So that's the number to the East Clinic. So the East Clinic right now is doing dental services. So we have some construction happening at our East Clinic. So we're not doing medical services over there at the moment, but we do have again a full service dental clinic. So if you are closer to DeKalb, or coming from Tucker, Stone Mountain, that East location, if you're looking for dental care, will probably be closer to you. And all of our staff in medical and dental are full-time employees. So we do not work with volunteers. And the reason why is we are big believers in continuity of care. A lot of our patients have been coming here for years and years, and they've been seeing the same provider for years and years. And that's really, really important. One thing you'll also note about our clinics when you come is we just take pride on how they look. We think that everyone should have a dignified experience when they come in. So we put a lot of effort into maintaining really nice settings for our patients and staff, because it's discounted, but it's a lot of money to our patients. And we just want to make sure they feel like they're getting that value for what they're giving to for service. And Shannon just put her email in the chat for anyone with specific dental questions. So yes, send those to Shannon. She'll be very good at answering those if you want to know a particular service or cost estimates for a particular service.
And how about our hours? If you want to touch on that and our late day and maybe a Saturday, if that's beneficial to the community.
Sure. So we are open from 7:30 to 4. And that is Monday, Tuesday, Wednesday, and Friday. And then our late day is Thursday night from 12 to 7. So for moms and dads who work, who can't get off to take their little ones to the doctor, we do offer one late day. And we are open the first Saturday of every month. So the first Saturday of every month from 8 to noon, you can be seen. Those Saturday appointments do fill up quickly though. So if you're looking for a Saturday appointment, be prepared to, and again, it's only once a month. So just make sure you call early or as soon as you know you want an appointment to try to get that time.
And I was going to add to what Shameka's saying. You can also go on our website, and a lot of the information too, in case, I know it sometimes can be a lot to write it down. You can go on our website, and I'll share it in the chat in case anybody wants to refer to it later as well. And I'll also drop in our chat our social media handles. It'll, in case you or anybody who would like to follow us, or if we also post a lot of information that's helpful to the community there, whether it's our dental summer special that we have going on right now, or, future potential patient testimonies. So yeah, there's just another great way for you to continue to stay engaged in what Good Sam does and how we're continuing to help the community and anything that may be upcoming later this year. So I'll share that as well in the chat.
Are there any other questions before we close? Well, as Evelyn is getting that last bit of info in the chat, again, I just want to thank you guys for taking the time out of your lunch your lunch hour, to spend it with us here to do our first virtual lunch and learn. So I will add that if you have any topic suggestions, like we have things we certainly want to present, but if there are any specific topics that you want us to address during these, we are going to try to do these. I guess it's every other month. So for now, so we are looking at our next topic for later in the fall, but certainly if there are other topics that you would like us to touch on, we're happy to do that. We manage so many conditions at Good Sam. We treat very complex patients. There's a lot of good information that our providers have that we want to share. We see some very interesting cases. I know I would be remiss in not saying this. Our director of clinical ops, we were telling a group yesterday that we actually had a leprosy case here not too long ago. Now, who would have thought, right? So we had that case here at Good Sam. So we have a lot of interesting complexities that we see that relate to public health, that relate to what we're seeing in the community. So we're anxious to share those topics during these lunch and learns and give you guys more insight. We also act as chronic disease management offer chronic disease management for diabetes and hypertension. A large majority of our patients suffer with that. So our staff is very well versed at taking care of those types of individuals. So we have a lot of exciting things that we want to share, and certainly want your feedback if there is something that you want us to cover. Okay. All right. Well, thank you guys so much for attending. Enjoy the rest of your day. We really appreciate what you all are doing in the community as well. And feel free to reach out if you have any other questions.